Birth defects and congenital anomalies. What you need to know. What is congenital disorders? Congenital disorders are conditions that are present at birth, caused by genetic or environmental factors during fetal development. These disorders can affect various parts of the body, including the organs, bones, muscles, and nervous system. Some examples of congenital disorders include Down syndrome, a genetic disorder caused by the presence of an extra copy of chromosome 21, resulting in intellectual disability, developmental delays, and distinctive facial features. Spina bifida, a neural tube defect where the spine and spinal cord don't develop properly, leading to varying degrees of paralysis and other health problems. Congenital heart defects, abnormalities in the structure or function of the heart that are present at birth, which can range from mild to severe and require medical intervention. Cleft lip and palate, a facial birth defect where there is a gap or split in the lip and/or roof of the mouth, which can affect speech and eating. Sickle cell anemia, a genetic blood disorder where red blood cells are misshapen and break down, leading to anemia, pain, and other complications. Please like and subscribe to our channel and click bell icon to get more health updates. Congenital disorders symptoms. Physical abnormalities. Many congenital disorders affect the physical development of the body, leading to malformations of the limbs or organs, such as cleft lip or palate, clubfoot, or heart defects. Intellectual disabilities or delays. Some congenital disorders affect cognitive development, leading to intellectual disabilities or delays in speech, language, or motor skills. Sensory impairments. Congenital disorders can also affect the senses, such as hearing or vision loss, or cause abnormalities in the sense organs, such as strabismus crossed eyes or nystagmus involuntary eye movement. Chronic medical conditions. Some congenital disorders can lead to chronic medical conditions, such as diabetes, asthma, or sickle cell anemia. Developmental delays. Congenital disorders can also cause delays in development, such as delayed walking, crawling, or other milestones. Increased risk of infections. Individuals with congenital disorders may have a weakened immune system or be more susceptible to infections or illnesses. Congenital disorders causes. Congenital disorders are caused by a variety of factors, including genetic and environmental factors. The exact cause of many congenital disorders is not fully understood, and some may be due to a combination of genetic and environmental factors. Here are some common causes of congenital disorders. Genetic factors. Many congenital disorders are caused by genetic factors, such as gene mutations or chromosomal abnormalities. These genetic changes can be inherited from one or both parents, or they can occur spontaneously during fetal development. Environmental factors. Exposure to certain environmental factors during pregnancy can also increase the risk of congenital disorders. These factors may include exposure to toxins, infections, or radiation. Maternal health. Maternal health during pregnancy can also play a role in the development of congenital disorders. For example, maternal infections, malnutrition, or drug or alcohol abuse can increase the risk of certain disorders. Problems with fetal development. Problems with fetal development during pregnancy can also lead to congenital disorders. For example, failure of the neural tube to close properly can lead to spina bifida, a type of neural tube defect. Congenital disorders treatment. Medications. Some congenital disorders can be treated with medications, such as antibiotics for infections or hormone therapy for endocrine disorders. Surgery. Surgery may be necessary to correct physical abnormalities, such as cleft lip or palate or heart defects. Physical therapy. Physical therapy can help improve mobility, strength, and coordination in individuals with physical abnormalities or developmental delays. Speech therapy. Speech therapy can help individuals with speech and language delays or difficulties. Special education. Individuals with intellectual disabilities or learning disorders may benefit from special education programs to help them achieve their full potential. Supportive care. Individuals with chronic medical conditions or disabilities may require ongoing supportive care, such as regular medical checkups or assistive devices. Genetic counseling. Genetic counseling may be recommended for individuals and families affected by congenital disorders to help them understand the risks of recurrence and make informed decisions about family planning. Congenital disorders prevention. Genetic counseling. Couples who have a family history of congenital disorders or who are at increased risk due to their age or other factors should consider genetic counseling. This can help them understand the risks and options for family planning, such as preconception or prenatal testing. Prenatal care. Regular prenatal care can help identify and manage conditions that can increase the risk of congenital disorders, such as infections or chronic medical conditions. This includes taking prenatal vitamins and following a healthy diet and lifestyle during pregnancy. Avoiding harmful substances. Pregnant women should avoid exposure to harmful substances that can increase the risk of congenital disorders, such as tobacco, alcohol, and certain medications. Managing chronic medical conditions. Women with chronic medical conditions such as diabetes or high blood pressure should work with their healthcare provider to manage these conditions during pregnancy, as poorly managed chronic conditions can increase the risk of congenital disorders. Vaccinations. Vaccinations can protect against infections that can increase the risk of congenital disorders, such as rubella. Environmental protection. Taking steps to reduce exposure to environmental toxins, such as lead or pesticides, can also reduce the risk of some congenital disorders. Thanks for watching. Please do like, subscribe and click bell icon for more health videos. Also lets us know, how would you want us to improvise videos, or which health condition you would like to explore in comment section.